So it looks as though the DOGE, Department of Government Efficiency, and Elon Musk is deep into Social Security books, supposedly looking for fraud, waste, and abuse. So we're going to talk about that today, and perhaps a little bit of revenge by the administration against a particular state governor. And I did a live Q&A today where I help people with all things Social Security, retirement, survivor benefits, disability, Medicare, Medicaid. And one question that kind of came up, so I'm going to talk about that a little bit more since I didn't get a chance to answer it fully today. So if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. Now I'm helping people make sure they get everything they earned from all of those agencies. And so make sure you subscribe, and that way you can find us in the future if you or your friends or family ever have any questions that they need answered. Because Social Security, unfortunately, they're losing all their staff. So yeah, it's very difficult to get a hold of Social Security nowadays. Okay, so the first article I want to talk about is DOGE is searching through the Social Security payments looking for fraud. And that's a beautiful thing. We like every eye on there to look for fraud. For Social Security, they estimate it's probably about a 1%. Social Security, about $1.2 trillion goes out from the Social Security Administration, and about 1% of that is fraud. Because in terms of the majority of the money going out there is retirement benefits, and it's hard to commit fraud in retirement type benefits. You either, you paid into Social Security, you're of that age. I think in my office, we had one person that was they're born overseas, and they contacted their vital statistics back in their particular country and got a fake birth certificate that says they're older, so they wouldn't be reduced for filing at 62. So retirement fraud, not very much. The big one is disability fraud, people working while receiving disability benefits. So anytime anybody can come in there and say, hey, here's a better way to get people to report disability and report their work while receiving disability, that's always a beautiful thing that I'm sure that the agency, as long as that's the purpose, and the purpose is not to, okay, we are going to, as Trump promised, not to cut the program unless evidence of fraud is found. And so far, no evidence of fraud has been found at the Social Security Administration. There's been a lot of allegations, the famous one about people 150 years old. I've talked about that a few times before, and that has been proven to be incorrect. The acting commissioner of the Social Security Administration, who is actually a DOGE guy himself, he was actually lower level Social Security employee. He was kind of under investigation because he was doing things not correctly, allegedly. And so he was looking for another job, and DOGE came in and says, you look like you're one of our guys. And so they kicked out the other acting commissioner, and they put him in. So, and he even admits recently in internal conversations that, yeah, the DOGE people really don't know the nuances of the Social Security Administration, and they're going to make mistakes, and but we have to give them access. And so we are hoping they don't do anything they're not supposed to do. Fraud is different than saying, okay, I don't like this program. I don't like children under the age of 18 receiving Social Security benefits. I don't like disabled children receiving disability benefits. I don't like divorced spouses receiving Social Security benefits. And therefore, I'm going to call it fraud, waste, and abuse, and we're just going to get rid of that. That's kind of what they've done to other agencies. Say, well, this particular law, this particular policy, yes, it was passed by the House of Representatives. Yes, it was passed by the Senate. Yes, it was signed in the president, but we just don't like it, and therefore we're going to call it fraud, waste, and abuse, and just go ahead and end it. Hopefully, that's not what we're looking at here. But I'm going to keep an eye on this. And I did a video about 3 or 4 days ago. If you're receiving disability benefits, I did a video on how to make sure your disability stays. Some of the tips, tricks, and secrets you can take now to make sure you're protected in case something like that happens. If you get a continuing disability review, I went over exactly how to address the continuing disability review, because we're looking to get a lot more of those. So yeah, it's a very tricky time. So, and Social Security, unfortunately, because the staffing shortages, they were already at a 50-year low, and now it's worse because 7, 8, 9, 10,000 people are going to be leaving the agency. So you're not going to get much help from them, unfortunately. So the Dudek, who is the acting commissioner of Social Security, saw what happened and when DOGE accessed the Department of Treasury, and he says this is not happening to the Social Security Administration. The Social Security Administration has been using a system, I'm sure you've heard, going back to the 1970s. Social Security has been begging, begging Congress for decades, give us resources to update this system. We're tired of, looking for these dinosaurs that know this old, programming language. Help us update the system up at least until the, 19th century or 20th century. And Congress has continuously refused to update the system. And Social Security has just basically been, working with, bubble gum and string for the past few decades. So if DOGE can come in there and they're computer geniuses and update the system, that's a beautiful thing. But in a lot of people's estimation out there, they're doing things backwards. Old Marine Corps sergeant, I was going to say it a different way, but I will stop that. You update the system, make things more efficient, and then you let people go because you don't need people anymore because you've made the system more efficient. They have done everything backwards and they let everybody go and shoot first, ask questions later type situation. And now that's going to hurt people out there that are looking to file for benefits, or if they have an issue, they need to, a Medicare card, or they need to deal with an overpayment, or they want to file for retirement or survivor benefits. The previous commissioner of the Social Security Administration, has been doing interviews that said, hey, if you're in that situation, you might have to wait a month, 2 months, 3 months, or 4 months for your benefit, for your first check to start. So it might be a good idea to have some money put away. And if you're looking for if that's also a delay in terms of starting your Medicare during a special enrollment period or something like that, then that might be an issue where you might have to, get with your doctor and get some extra medications or healthcare, something. It's a crazy time, but I'm going to keep up on it. And if you got any particular questions on your particular case, make sure you join my live Q&A. Another story is the Social Security chief reverses course on an ending contracts affecting Maine, the state of Maine. Probably saw that the governor and the president had a little tiff in the White House. And so it looks like kind of right after that, the commissioner, the acting commissioner of Social Security, decided to cancel the contract for Maine. And what the contract is the enumeration at birth. So basically, in all 50 states, if you have a child, you can, you get your birth certificate at the hospital, and then you can apply for the Social Security card at the hospital, and then the hospital forwards it to the Social Security Administration. The Social Security Administration produces a Social Security card, sends it to you, and it's done. Because of that little tiff, perhaps the coincidence, it's very coincidental. Maine, they said, yeah, we're not going to do that for you. So everybody that lives in Maine, you have to go down to the Social Security Administration after you get out of the hospital and apply. All the other 49 states, no, we'll do it for you. But Maine, since you talk back, I guess, then we're going to, And then, so the Commissioner of Social Security Administration, he says, oh, I apologize. I didn't mean to do that. Really? That seems kind of interesting. And they also have another program, the electronic death file record. And that's basically the same type of situation where if somebody passes away in a particular state, they automatically notify the Social Security Administration, who notifies the Department of Treasury, and they suck that money out automatically. If you ever had anybody that passed away and they were receiving Social Security, it happened really, really fast. So those are a couple of things that are happening out there. I'm going to keep up on all this stuff, but let's talk about one of the questions I was not able to get to today about people receiving benefits. And then one thing, hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I looked for a place that would help you all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call, and they'll see if they can help you out, and tell them Dr. Ed said hi. I've noticed it's continuing. People are missing benefits because they're filing at the wrong time. So here's the kind of the layout. If you are filing for surviving spouse benefits, you can start those benefits at 60. I see too many people starting at 62 because, everybody thinks 62. No, for surviving spouse benefits, you can start at 60 years old. Earlier, if you're disabled, it's called disabled widows benefits. Disabled widows benefits you can get from 50 to 59, starting 60, just regular old, surviving spouse benefits. In terms of regular retirement benefits on your own record, spouse benefits, your current spouse, divorced spouse, that starts at 62 years old. Obviously, that's a full reduction because you're starting, years earlier than your full retirement age. Medicare starts at 65 unless you're receiving disability benefits, SSDI. If you're approved for disability benefits, your Medicare starts after 2 years. But other than that, your Medicare starts at 65. If you're currently receiving Social Security benefits, then your Medicare will start automatically. They'll send you your Medicare card in the mail about 100 days before you hit your 65th birthday. If you're not receiving monthly benefits, then you do have to file to sign up for Medicare if you want to sign up for Medicare. If you have insurance through current work, yours or your spouse's, you do not have to sign up for Medicare. That employer has to have 20 or more employees, and it has to be current employment. It can't be a retirement plan or the Affordable Care Act or COBRA or anything like that. It has to be current employment. And save yourself $185, and you don't have to enroll. If you stop working 5-10 years later, you or your spouse, then you would enroll in Part B at that time, Part A, Part B, whatever, and depending on your situation, and then you won't get penalized. You have to fill out a couple of forms to prove you had health insurance since you turned 65, but pretty easy there. And if you're new to Medicare and 11,000 people are turning 65 every day and people need help with Medicare, that's why I partnered up with Chapter. You can call them up and they'll always check out a Medicare supplement first. So if you call Chapter, anybody, say, hey, tell me about Medicare supplement, N, G, F. Can I get any of those? How much are they? There is a monthly premium for those. Do I have to go through any health underwriting? And then you look at those. And if it's not right for you, then you start checking out Medicare Advantage plans. That way you don't have to deal with, prior authorizations and networks and all the rest of it. So Chapter can help you out. They help out. It's 100% free and they work in all states. All right. So the next thing is your full retirement age, 66 and 8 months or 67. If you were born in 1960 and after, your full retirement age is 67 years old. And remember, once you hit your full retirement age, you can work as much as you want and nothing is withheld at all. And the next date is 70 years old. That's when you receive your max delayed retirement credits on your own record. So if you're filing for retirement benefits on your own record, you can file at 67 if your full retirement is 67, or you can file at 70. And if you file at 70, you're delaying 3 years. And for the delayed retirement credits, you get 8% every year. So let's say your full benefit amount at your full retirement age is $1,000. If you wait until 70, 24% plus, so you'll get $1,240 for the rest of your life. So those are the ages: 60, 62, 65, 67, 70. So hopefully I see you one of the live Q&As. Make sure you subscribe and like and share. There's too many people out there that are filing at the wrong time, getting the wrong check, filing for the wrong program. And that's why I do a live Q&A on a regular basis. And hopefully we will see you or your friends or family there. Take care and have a beautiful night.